Over the last decade, there's been much higher recognition of the importance of sustaining good levels of mental health and well-being in society generally. This is recognised by the WHO Sustainable Development Goal to ensure healthy lives and to promote well-being for all at all ages. Within the EU, we have seen statements from the European Commission in the New Era communications about the importance of good mental health and well-being for researchers. The recent impact of COVID-19 restrictions has also drawn a sharp focus on mental health and well-being, with early career researchers at both doctoral and postdoctoral level seeing their research activity significantly disrupted and exhibiting high levels of concern about the impact this will have on their career prospects. But we also see the impact of COVID on the mental health and well-being of mid-career researchers through additional pressures on delivering their teaching online and increased administrative duties throughout this period. Recent data in the UK and more widely is showing that levels of anxiety and probable depression are running twice as high in researchers as in the general population. So why is poor mental health and well-being so high in academia? There is no reason why working in academia should be any more stressful than in other employment sectors. The vast majority of academics and researchers are passionate about research and teaching, and for many it is a vocational commitment. Many researchers talk to me about it being their ideal job. However, in the same breath, they also say, except for the working environment and culture. What is it about the working environment in academia that leads to poor mental health and well-being? Perhaps unique to academia, there are systemic issues within the public research system that impact on the mental health and well-being of researchers. The pressure to publish, secure grant income, the individualization of the research system, fixed-term contracts, and institutional league tables are all strong drivers of individual and organizational behaviors, and not necessarily healthy behaviors, particularly in relationship to the impact on mental health and well-being. So behavior is learned and determined culture, and culture determines behavior. To change the culture within academia to one that is healthy and allows individuals to flourish is essentially a wicked problem. It is not one that can be solved easily and may never be solved, but that should not stop us from attempting to do so. However, it will take all actors at all levels within the research system to tackle this. As Eldridge Cleaver said, you either have to be part of the solution or you're going to be part of the problem. ReMO, the Researcher Mental Health Observatory, will play an active part in finding solutions to this wicked problem and in taking a comprehensive approach to tackling the issue of mental health and well-being in academia. We have set up 3 working groups to examine mental health and well-being at different levels within the research environment, at the systemic level, the institutional level, and at the individual researcher level. It is critical that responsibility for mental health and well-being is not delegated down to the individual researchers. The responsibility also lies on research performing organizations as employers, on funders, policymakers, and publishers. All stakeholders need to play their part in improving the systemic drivers, the research environment, and the culture. Within ReMO, one working group will focus at the policy level on how to transform the research ecosystem to benefit researchers' mental health and well-being. It will provide a platform for open, constructive, and ongoing dialogue between various stakeholders within countries and across the EU. It'll work towards systemic and structural data collection on well-being and working conditions to challenge, inform, and monitor national and European situation and priorities. It will maintain an open access evidence hub to collect and disseminate cutting-edge evidence and tools to support policy and practice at all levels. It will contribute to work to revise the academic reward system for individuals and organisations so as to support better mental health and well-being. And it will finally develop strategies for how the EU and national project-based funding can be used more sustainably to lead to improved career prospects within and beyond academia. As I said earlier, this is a wicked problem and not easy to solve, but it is well worth making our best endeavours to solve it. We need everybody to contribute to finding and implementing solutions. Please join us at ReMO.